Namaste. I'm Dr. Rachita Sarangi, consultant Retina and UVA, Center for Sight Group of Eye Hospitals in Hyderabad. We will be talking about a few conditions involving the retina. The first and the foremost is diabetic retinopathy. So we all know that diabetes mellitus is a very big major health challenge nowadays worldwide, and in India also the prevalence is very high, and it is a silent killer. It involves almost all the organs in our body, eye also being one of the main organs that are involved. And in the eye, it involves the retina, which is the visually most important part of the eye, and this is called diabetic retinopathy. Diabetic retinopathy initially doesn't cause any symptoms, so the patients will not be aware that diabetic retinopathy has started or not. That is why we advise that once a diabetes mellitus diagnosis has been made for a patient, the patient has to go for an annual or a yearly retina evaluation. When the patients do not come for regular checkups, they come to us at a stage where diabetic retinopathy has already involved their vision. So the symptoms they usually come to us with is blurring of vision. That can be due to diabetic macular edema, or that is fluid collecting within the retina, or the other important thing being vitreous hemorrhage, that is bleeding into the eye, bleeding from the retina, bleeding into the eye, which is blocking your vision. So these stages can be treated with either lasers or injections. Sometimes surgery may also be required. But what patients need to know is sometimes some damage that is done during these stages are permanent. Even with a surgery, we may not be able to reverse the damage once done. So if a diagnosis of diabetes is made, please get an annual eye checkup or a retina evaluation done without fail, so that we can save your vision.
Follow Center for Sight and post your queries to get answers from the experts.